Doctors of Reddit. What is your most heartbreaking diagnosis? Story 1. Brave Souls of Pediatric Oncology.
Most patients in the pediatric oncology ward, really. I remember my first time on that ward, about half a year into my internship. I was tasked with putting an IV access in, and then taking a blood sample from this young and longtime patient of that ward, like many pediatric oncology patients there, to send to the lab to get new blood to transfuse for her. To preface, putting in an IV access is already much harder on kids than it is for adults, and if the kids are cachectic, super young, and their veins have been poked at for years and years for treatment, then that task gets exponentially difficult. At that point, I was used to kids who would cry and tear the room down when they even glanced at a needle. This ward was different. Me, being more or less a very green, fresh doctor at the time, must have seemed noticeably anxious because this patient looked me dead in the eyes and, in the calmest manner, said, "Doc, don't worry, I'm not going to fight you. This is just my life. Get it over with." She took the stick to her vein emotionless, then went right back to scrolling through on her iPad. That was when I understood her words. That normal life for them included getting needle sticks from unfamiliar doctors and nurses, hospital beds, and having to hear other babies cry all day, every day. All doctors get desensitized to some degree. It's part of the job. But to know that those kids get numb to all this truly broke something in my heart.
Story 2. Midnight Medical Emergency.
Dentist here. An 18-year-old kid needed either dentures or 30 KIs for a full mouth of crowns. He had genetic enamel hypoplasia leading to soft enamel, and his teeth had eroded to little nubs. When I presented this info to him and his parents, they laughed at the idea of spending that much on his teeth and said, "Well, looks like we are letting them fall out and getting you dentures later." He seemed genuinely distraught. I felt pretty sad about the case, so I called them a few days later, offering to do the case as charity, and I would charge nothing. They said they would consider it, but never called me back. I tried following up, and they didn't return my calls. This was a year ago, and I think about it a lot.
Story 3. Urgent Call, Lifesaving Night.
I work in rural medicine now, but prior to that I was in hematology, both clinical and lab. I dealt with many leukemia diagnoses and saw plenty of young and old adults pass away. But perhaps one of the most heartbreaking things I had to do was when I worked in the lab. I got a call in the middle of the night from one of our scientists with a blood sample they'd received from a rural doctor that had arrived quite late. It was from a 5-year-old, I think. When it went through the machine, it had some worrying counts, so the scientist looked at it in the middle of the night rather than in the morning. They were concerned enough to get me to take a look and emailed me a bunch of photos taken of the slides. The child had absolutely raging leukemia with massive cancerous cell counts, and normal cell counts absolutely tanked. There was a high risk of spontaneous bleeding in their gut or brain, something that had to be dealt with right now. But the doctor who requested the bloods couldn't be contacted. So I tried to call the parents, as this kid needed to not just be in a hospital ASAP, but needed transfusions and to be on a plane to fly about 1,000 kilometers to a specialized pediatric hospital ASAP. Alas, I couldn't get the parents on the phone either. So I called their local ambulance. I sent them at about 1 a.m. to go bash on their door until someone answered and take that kid to the local hospital. In the meantime, I'd be arranging their medical flight to the city. I got all the people along that chain on board. All of that went as smoothly as one could hope. But it broke my heart to think how traumatic that would have been for that family. It's bad enough to learn your kid has such a terrible disease, but to learn by red and blue lights and someone bashing on your door at 1 a.m. Edit. Just to add, since quite a few have asked. The kid got to the hospital, was transfused safely, we had to get it sent over from another town, and was air transported to the city safely. I didn't get any further communication beyond that other than some of the additional tests I requested that night. The kind of leukemia they had is very aggressive, but the survival rates with modern treatment are very high, 90% plus at 5 years. So they likely did well. They'd probably be finishing their treatment around now. Also, I changed a part. As I recall now, I didn't go into work. I did that from my mother-in-law's home office. The scientist emailed me a horde of photos of the film. The downside of that is, we only get paid for call-ins, not calls to us at home, so it meant I was up for hours in the middle of the night for no pay. But that's the life.
Story 4. Two tragic diagnoses.
A 60-something retired nurse presented with rapidly progressive cognitive changes and odd movements. Workup revealed she had Creutzfeldt-Jakob disease. She was with it enough to understand the diagnosis and simply cried to her husband, saying, "I'm sorry for what I'm about to put you through." She was discharged on hospice and passed away after a few weeks. A 30-year-old female came in with some mild difficulty walking and sensory deficits in her legs. We performed an MRI of her brain and spine and saw these ovoid-enhancing lesions in her brainstem and cervical spine. She had recently emigrated from an underdeveloped country, making us think this was an odd presentation of an infection like tuberculosis. We performed a lumbar puncture and didn't see any signs of infection or inflammation, so we enlisted the help of neuroinfectious disease experts from other institutions to no avail. Over the 2 to 3 weeks she was in the hospital, she went from walking the halls to a quadriplegic. Eventually, one of the lesions expanded to a point where we could reasonably safely biopsy it. The biopsy came back as glioblastoma. These types of tumors rarely present in the spine and brainstem, and there was nothing we could do to help her. She was discharged home on hospice and died a couple of weeks later.
Story 5. Heartbreaking anesthesia. Discussion.
I'm an anesthesiologist, and I had to talk with a patient about anesthesiology risks. The patient was an 11-year-old orphan. Normally, I talk to parents when it comes to children. But this one gutted me because I read the patient's documents and learned that her dad had an accident at work and is mentally impaired, and her mother left her to go back to her home country. She came with 2 workers from the orphanage who were hardly 20. Basically, 3 kids in my eyes. Until this point, I never thought about orphans needing medical care because it never dawned on me. But goddamn, I needed a pause after this.
Story 6. Heartbreaking choice and lost time.
My dad is an oncologist. He told me about a woman who declined treatment because her husband threatened to leave her if she lost her hair. Seriously. He was the only family she had, and she didn't want to lose him. My dad tried to reason with her. He asked if he could talk to her husband, who didn't come to the few appointments she attended. But she refused and disappeared for about 6 months. Then she came back because she had begun to physically decline, and her husband had left her. She wanted treatment since she had nothing left to lose at that point. But the disease was too far gone and she didn't make it. She was 25. That's definitely one of the more devastating and infuriating stories he's told me.
Story 7. Unexpected cancer discoveries.
Not a doctor, but an ER nurse. I absolutely hate when we find cancer in someone who comes in due to some vague symptoms. Whether it be blood in the urine that turns into bladder cancer, difficulty urinating that turns into prostate cancer, or we do a belly CT and see nodules on the lungs. The worst part is, we don't know 100% if this mass or spot is cancer. We can just tell you about it and have you follow up. I can't imagine the stress of waiting to know for sure, and how bad it is. My worst was a woman in her early 30s who had just beaten breast cancer. She was a widow with no kids, and her only parent had recently died of ovarian cancer. I saw her for abdominal pain, and on the CT, we found an ovarian mass. When we told her, she just looked so alone and devastated. I am not a hugger, but she definitely got my longest hug to a patient in my career.
Story 8. Unbreakable spirit. Life after paralysis.
I have a patient who is a quadriplegic and bedbound. She is currently 25. At 23, she had a post-drug reaction over the span of 2 days, which left her completely paralyzed from the neck down. She was completely healthy prior, traveled a lot, did slam poetry, and was a beautiful singer with a strong voice. Now she is non-mobile. Her voice is a whisper, tracheal tube, and she needs someone to help with basic motor functions like itching her own nose. She can't clean herself, and, therefore, wears an adult diaper. She has not gone out to see the sun in 2 years, and is by far one of the most charitable, gracious, and kindest young ladies. Neuromyelitis optica. I always put an extra hour to the side for when I go to see her. We will talk, do our nails, or watch TV together. I've learned a lot from her life previously, her family, and experiences I could never imagine. I always tell my patients that they know their own condition better than I do as a doctor. They have lived it. They know their body better than I do. So I ask them to please tell me everything, why they think they are experiencing their symptoms and what they think may help them feel better. I ask these things before I impose any treatment plan because everyone is so different. We find a treatment plan that works the best together. I love my job. I love my patients. I love helping people. These are the cases that have me awake at night with a heavy heart.
Story 9. From healthy to tragedy, a rapid decline.
A 15-year-old kid had a headache and stuffy nose for a couple of days. His mother thought he was trying to get out of school. By day 4 or 5, he was drowsy and not easily rousable, so he was presented to the hospital. He had an intracranial extension of sinusitis, subdural empyema, dural venous sinus thrombosis, and evolving venous infarct. He underwent a large craniectomy to wash out the empyema and allow expansion. He developed a large intraparenchymal hemorrhage following surgery. The next day, the empyema started collecting again, even with the open skull and drains in situ. He had more infarcts, now including in posterior fossa structures. A few days later, he developed a contralateral empyema. He underwent a second large craniectomy. More swelling, more infarcts. Life support was withdrawn a few days after that. I think he went from healthy to dead in 2-3 weeks. I checked what the lab cultured. I can't remember them right now, but the kid had organisms I had never heard of. Real left field stuff. Given how septic he was, they probably couldn't even use his organs. A really sad case.
Story 10. Bittersweet ER wedding.
During my time in the ER, I had a patient with metastasized prostate cancer come in with a severe headache. A CT scan revealed he had a brain bleed due to the metastases, and he likely had only a few days left. When I told him, he teared up and said he was supposed to get married in 2 weeks. So that night, another doctor and I decided to organize a wedding in the hospital. We got an officiant for the next day. His fiancée arrived that night. I remember them sitting together, holding hands and watching the stars through the emergency room window. She spent the night in the bed next to him, and they held hands all night. They got married the next day, surrounded by a few friends and hospital staff. 2 weeks later, he passed away, married to the love of his life. I still get teary-eyed when I think about it. It was such a bittersweet moment, and one of the most memorable patient encounters I've had.
Story 11. A surgeon's heartbreaking loss.
Not a doctor, but I used to teach lunchtime EFL classes at a hospital. One day, the heart surgeon came in with a really long face. He had one kid come in who had no real symptoms, but the valves in his heart were narrowing, so without surgery, he was doomed in the long term. So they decided to cut out one small valve and one big valve and transplant the big valve to where the small valve had been removed and put an artificial valve where the big valve had been. At least that was the gist of it. It was a long time ago, and I don't know medical terminology at all. The transplant didn't take, and the kid died. He'd just come in from an hour of the parents screaming at him for killing their kid. They were taking it especially badly since the kid wasn't displaying any symptoms before the operation. And this guy was really good at his job. He had awards for open heart surgery and had done a successful heart and 2-lung transplant on a woman who had lung cancer spread to her heart. But everyone has things go wrong. Just know I could never do a job where the off days mean people die. I really didn't know what to say to the guy.
Thank you for listening. I hope you've enjoyed the stories. If you did, remember to like and subscribe for more.